Hello, it's Bruce Williams again, and today I want to present part 2 of my series on the selected gross pathology of mice and rats. And we're going to talk about the hematolymphatic system and the gastrointestinal system of mice today. Before I start, I want to thank those colleagues and friends who have shaped the area of rodent pathology as well as shared their images with me over the years, which allow me to put these lectures together. First, let's talk with a few general comments about the hematopoietic system of mice. A couple things that you need to know about mice. In terms of circulating leukocytes, about 75% are going to be lymphocytes. There is some gender diversity in terms of granulocyte counts, with male mice having significantly higher counts of granulocytes in the peripheral blood. And when you look at granulocytes in tissue, they often have a ring-shaped, or I call donut-shaped, nuclei. Hematopoiesis in mice is usually present in long bones throughout life, and is usually present in the spleen and often in other organs, such as the liver and the adrenal gland. When we talk about the thymus, in mice it does not involute, and Hassel's corpuscles, as composed to most of our domestic species, are indistinct. Oftentimes you'll see a mixture of the thymus, the thyroid, and the parathyroid glands. Rodents don't have tonsils. And within lymph nodes, germinal centers are often not well defined. A very common finding, especially as animals increase in age, are lymphocyte aggregates, which tend to accumulate in a number of very characteristic areas around the renal interlobular arteries, salivary gland ducts, within the urinary bladder submucosa, and other sites. Lymphoid infiltrates is a very common morphologic diagnosis when you are reading out studies involving older mice. And as a general rule, in lymphoproliferative diseases, lymphocytes often accumulate in large numbers first in these areas as well. Okay, got all that? Well, let's move on to look at some images. When we talk about the hematolymphatic system in mice, we're pretty much talking about lymphoma. Let me give you a couple basic rules on lymphoma in mice. Pretty much all lymphoma in mice arise as a result of retroviral infections. They are the result of the Maloney-Muri leukemia retrovirus, which is seen pretty much in 100% of all laboratory and wild mus musculus, or mice. It exists as provirus within the genome of the mouse, and the Maloney virus was named after Dr. John Maloney from the National Cancer Institute, who devoted his career to research in the properties of tumor viruses and leukemia agents, with particular emphasis on the Maloney virus as well as the Rouse sarcoma virus. The provirus is scattered throughout the genome with up to 70 copies of mouse leukemia viruses in some strains. In addition to lymphoma, its expression may be related to other disease manifestations in mice, including demyelination, dilute color, hairlessness, or a gray coloration. There used to be some exogenous viruses, including the Friend and Rauscher strains, but those have pretty much been eliminated. So horizontal transmission through saliva, milk, or semen is not considered to be prominent or even exist any longer. In the mouse, as we said before, most if not all lymphomas arise as a result of retroviral infections, and most lymphomas are of B or pre-B cell origin and tend to arise in the spleen. This particular mouse, although we cannot see what's going on in the spleen, has all of its lymph nodes are very enlarged. In this mouse, the mesenteric lymph node is markedly enlarged, but we can also see changes in the spleen, which has this lumpy, bumpy appearance and is likely filled with lymphoma, and there is a color change here in the liver, which is likely a result of large numbers of infiltrating neoplastic lymphocytes. Another mouse with very large lymph nodes, an enlarged liver, and a very large thymus. In certain strains of mouse, such as the AKR mouse, there is almost 100% incidence of thymic lymphoma. Lymphoma is a very common issue in AKR and C58 mouse, and very common in skid mice and other immunodeficients as well. It's likely that because the thymus persists into adult life, it predisposes some species to the development of these tumors. Here's a nude mouse with a couple of very important concepts to know about lymphoma. The first is, whenever you see a large spleen and liver in a mouse or a rat, I want you to default to lymphoma. The causes of these changes are very rare other than lymphoma. We will talk about one, but there are tremendous numbers of pictures of mice and rats floating around out there with their abdomens open, with huge spleens and livers, and if you say lymphoma, you can never be totally wrong. There are a couple of other things going on in this particular animal. We have a large thymic mass, which is probably lymphoma, and then we have the pale color to the lungs, which is often associated with interstitial pneumonia. Now, another important concept is the incidence of lymphoma in nude mice or other severely combined immunodeficient mice. When we think about skid mice, we think that they have no cell-mediated immunity. They have no lymphocytes. And so why would they be developing lymphoma? It seems fairly counterintuitive. Well, the truth is that skid mice do have lymphocytes. They do tend to increase in number over age. They are quote-unquote leaky. So it's not that they are devoid of lymphocytes. However, these lymphocytes are deficient, and they are unable to monitor the system for the development of neoplasms. If lymphoma develops, and we've already talked about how many mice are infected with endogenous retroviruses, it will generally be missed, and the immunodeficient mouse will die of lymphoma. So, lymphoma, very common in older immunodeficient mice. It's a huge liver, it's a huge spleen. I'm going with lymphoma. Are you starting to get a pattern now? It's a huge liver here, it's a huge spleen. I'm going with lymphoma. But this one is histiocytic sarcoma. In mice, histiocytic sarcomas arise from cells of the mononuclear phagocytic system and commonly affect the liver, in females the uterus, and less commonly the spleen, lymph nodes, lung, kidney, and bone marrow. If you select 100 mice with big kidney and big spleen, I'll put it at about 5%, no more. It is fairly common in B6 and SJL mice and likely arises from tissue histiocytes or possibly Kupffer cells in the liver, as opposed to lymphoma, its incidence rarely occurs before 12 months of age, even in strains like the C57 black 6 mice, who have a higher incidence than other strains. In affected tissues, such as the liver, it's histologically unique. It tends to vary. Some are spindle-shaped, some are very pleomorphic, some may show erythrophagocytosis, and is often associated with an increased level of extramedullary hematopoiesis. Additional things that you'll see in animals with histiocytic sarcoma include hyaline droplet renal disease, as the tumor cells secrete lysozyme, and this is accumulated within the epithelium of the kidney, as well as a generalized decreased myelopoiesis. The presence of a tumor within the uterus is fairly diagnostic, and I will always take a look on H&E at that kidney for the presence of protein inclusions within the cytoplasm of the renal epithelium. It's also seen in rats too. And immunomarkers, if your laboratory uses antibody blockers, which allow immunos to be selective against various compounds in mice and rats, would include lysozyme, MAC2, and F480. Okay, let's move on to the gastrointestinal system. A couple of general notes. Mice are coprophagic, with about a third of their dietary intake being feces. The incisors grow continuously, but cheek teeth have roots. Mice have no deciduous teeth, and their incisors are often pigmented due to the deposition of iron beneath the enamel layer. When we look at their salivary glands, there is a sexual dimorphism which is present within them. In males, the glands tend to be larger, with serous salivary gland cells having profound granules within their cytoplasm. In pregnant and lactating females, the glands tend to go a quote-unquote masculinization with development of the granules within this time of their lives. GI tract is not that different than other species. There's lots and lots of Paneth cells, and mice have a very short rectum, which is not enveloped in any serosa, which makes it prone to prolapse. Malocclusion. As opposed to rabbits, mice and rats generally have no predisposing causes. There's no change in length of either of the mandible or the maxilla to account for something like this. A genetic basis has been predisposed for malocclusion in some strains of mice, and in other strains of mice it's been linked to trauma to developing teeth on cage lids or fighting or food that is considered too hard. Often the first sign that will be noticed in weanling mice of malocclusion is that a mouse is smaller or thinner than its cage mates. As we said before, the coloration of the incisors in mice and other rodents is often dark due to the presence of iron pigment underneath the enamel. Not all, even though they are rooted, you can have malocclusive changes in the cheek teeth as well, this one incorporating and entrapping the tongue. In terms of a hereditary basis, B6 mice tend to have a slightly higher incidence of malocclusion than most other strains. Okay, when I look at a mouse and I see a large mass in the skin just about anywhere, I'm probably going to think about mouse mammary tumors first, because mammary tumor viruses are also extremely common in mice. However, in certain types of inbred mice, white inbred mice, especially Balb C, and the females are more predisposed, there is a particular type of neoplasm which arises from the myoepithelium of the salivary gland. We call these salivary gland myoepitheliomas. These are usually seen in older females and are often associated with myeloid hyperplasia of the bone marrow due to an undocumented substance which appears to be secreted by these tumors. These neoplasms are generally cystic and are considered by many to be low-grade malignancies based on cellular characteristics. But they tend not to metastasize, if ever, and they often will attain a rather large size before the animal is sacrificed. Salivary gland myoepithelioma. Think of it in white female mice. And here's one more. Normal on the left, abnormal on the bottom right, and this is megasophagus. Megasophagus is usually seen in Swiss ICRC mice. Affected animals have a longer segment of the esophagus with smooth muscle, as well as aplasia of the myenteric plexus, resulting in a diffuse dilation on both sides of the diaphragm. The mucosa is often markedly hyperplastic, and these animals will readily develop esophageal papillomas much faster than other types of mice when administering certain carcinogens such as diethylnitrosamine within their water. There's another knockout type of mouse which gets megasophagus. This is the Adusin 1 null mice, if you're into memorizing the various attributes of transgenic mice. Here's a mouse stomach. This is our first look at the mouse stomach, and mice have a large area of squamous epithelium within their stomach, somewhat like horses. This particular stomach shows a diffuse glandular necrosis and hemorrhage. This is occasionally seen with various toxicants in mice, including saccharin and alcohol. It could also be a very, very bad case of ulcers. In this section of stomach, there is profound glandular hypertrophy and hyperplasia. This is a finding that's occasionally seen in immunodeficient mice, and the cause is generally not known. You can also see it in a spontaneous form in a number of mouse strains, including 129 SV mice, CD1s, which is one that I work with at the Joint Pathology Center, aging C57 blacks, and Han-Namri mice. There are a number of other causes here too, including experimental infection with Helicobacter felis, experimental infection, especially of immunodeficient animals, with Taenia teneaformis. You can see this in any other lesion. In knockouts and transgenics, you can make just about any type of pathology you want in a transgenic. So I don't like working with transgenic mice. I'm still trying to get my head around all of the magical things that happen spontaneously in nature, and then we go and change the rules and knock in a gene or knock out a gene, and then all the rules change. And then occasionally you can see it associated with colitis, and in mice that are housed in large numbers together, or densely housed mice. So this is a nonspecific finding that can be due to a large number of potential causes, or you often will never find out the cause. Gastric ulcers. It is stressful being a laboratory animal. There's no denying that. And we saw something that could be gastric ulcers before. These are fairly classic gastric ulcers, most commonly present in the pyloric stomach. I'm a big fan of the pyloric stomach. There's not much that happens in any other part of the stomach in most animal species. But ulceration most commonly occurs at the areas where the acid pH of the stomach meets the basic pH of the small intestine. And blood vessels there tend to run a little closer to the surface. They've also been induced in Helicobacter research in mice, but are considered primarily to be the result of stress, concurrent disease, and may be aggravated by non-steroidal anti-inflammatory disease drug administration. Here are multiple gastric papillomas. These may be seen in a number of transgenic strains, especially those whose RAS genes have been mutated. And classically, they have been induced over the years in mice and a number of other species by the administration of a number of carcinogens. Okay, let's move on to some spontaneous disease, some spontaneous infectious disease, and we're looking at 3 very young pups with diarrhea. And there are a number of conditions that will cause this particular appearance. And this gross image should generate a differential diagnosis of diarrheal diseases in mice, which would include enterotropic mouse hepatitis virus, rotavirus, which causes a disease in mice known as epizootic diarrhea of infant mice, or EDIM, various forms of salmonella, Clostridium piliforme, the causative agent of Tizer's disease, reovirus type 3, and in immunodeficient animals, mouse norovirus. Of these mouse hepatitis virus, the enterotropic form, remember this comes in 2 flavors, and we're going to talk about the polytropic form, which affects a wide range of tissues in the next lecture, which will be on liver disease in mice. But the enterotropic forms are extremely common and result in epizootic disease, which ranges in mortality. Highest mortality seen in neonates and young animals, and it tends to be subclinical among adults. Even though it's called the enterotropic strain, there are 2 biotypes. There's an enteric one as well as a respiratory form, which replicates in nasal epithelium before disseminating to its secondary target organs, including the lung, the liver, the lymphoid tissues, etc. Enteric strains are usually restricted to the mucosa of the GI tract, do not tend to disseminate to other organs, and primarily target the cecum and the ascending colon. The disease tends to be acute in immunocompetent mice, but immunodeficient mice may harbor an enzootic infection because they cannot clear their infection. They also will present with some really novel manifestations, including granulomatous serositis, which looks a little bit like feline infectious peritonitis in certain strains of knockout mice. It is transmitted from animal to animal by oral fecal means, with vertical transmission considered unlikely. The passage of these strains is even more confusing when you consider that immunity is virus strain specific and short-lived, and so animals can be repeatedly or apparently repeatedly infected by different strains of the virus. Here is a mouse pup with fecal staining, and then we have accumulation of curdled milk within the duodenum and proximal intestine. This is what is seen with rotavirus infection. Rotavirus is always a disease of the very young and characteristically infects the cells of the apical intestine, resulting in necrosis, contraction of those villi, reepithelialization, and loss of tremendous amounts of surface absorptive and digestive areas in the intestine. So the animals develop diarrhea and cannot absorb nutrients from the milk because it targets these terminally differentiated enterocytes. The animals don't develop cryptnecrosis, and they can survive rotaviral infection. Certain strains, including BALB-Cs, are relatively susceptible. This is a white mouse, perhaps it's a BALB-C. And then certain other strains are considered relatively resistant, including B6 mice. Characteristically, the disease is seen in mouse pups less than 14 days old. They have abdominal bloating, this pasting of the feces, and they are runted. They continue to nurse, and then older mice within the colony will show absolutely no clinical signs. While not specific, this appearance of the quote-unquote greasy mouse is suggestive of infection with mouse reovirus type 3. They get this greasy appearance because of the steatorrhea and diarrhea, and as they clean themselves, they get this diarrhea and all the fat that is not digested into their fur, giving them this sticky appearance, although you can see the same thing with rotavirus in young mice as well. Unlike rotavirus, however, reovirus can result in necrosis in multiple organs, including necrotizing encephalitis, hepatitis, and myocarditis. Here is an interesting, somewhat nonspecific lesion of marked abdominal or intestinal dilation or adynamic ileus. The first thing that I'm going to think about when I see this lesion is, was the animal inoculated intraperitoneally with some type of anesthetic agent? Classic lesion that often results in ileus and marked distension. This particular animal is a C57 black, and a number of papers have been published about a spontaneous fatal pseudoobstruction that generally occurs in dams or female mice in the second week of lactation. There's widespread apoptosis of the villar epithelium of the small intestine, which is associated with strong expression of activated caspase 3. No neuronal changes or infectious agents were ever identified in these animals, and it's been called paralytic ileus of C57 blacks, resulting in up to 40% mortality of animals in this particular category, the second week of lactation. Here's another dilated intestine in a white mouse. First, I'm going to think about a complication of intraperitoneal injection. Used to be pentobarbital, now it's Avertin, but any of those, when given intraperitoneally, are not only very irritating, but can also result in ileus. The possibility in a white mouse, in some strains, would be aganglionosis. Remember that color changes such as albinism or birth defects, often resulting in, as a result of a diminished migration of pigment-containing cells from the neural tube during development. And you can see all sorts of other things, including diminished migration of cells that form the neural innervation for the intestine. White animals of a number of species have been well known to have problems with their intestine. The APC-Min mouse is a commonly used intestinal and colonic cancer molecule which develops multiple intestinal neoplasia, similar to familial colonic polyposis in humans. The APC gene, which is similar to humans with polyposis coli, has been knocked out of these particular mice, and they will readily develop intestinal papillomas, adenomas, and carcinomas due to enhanced expression of the c-Myc oncogene. Here's an absolutely amazing size of an intestinal polypoid carcinoma. Spontaneous disease in a mouse. This is fat necrosis of the omental and mesenteric fat. It's often spontaneous. It may be associated with various causes of pancreatic necrosis or the feeding of a choline deficient diet. Here's a classic lesion. This is the colon with normal control on the bottom and a very enlarged colon with marked mucosal hyperplasia on top. Classically, this has been associated with a bacterium known as Citrobacter freundii. It has since been renamed to Citrobacter rodentium and was called transmissible ileal or transmissible colonic hyperplasia. It's considered a rare condition now. Usually tends to occur in young mice. You can see variable levels of inflammation and ulceration, and age, diet, and genotype are all considered predisposing factors for this disease. Citrobacter attaches to the surface mucosa, but generally disappears at the time of peak disease, about 2 weeks after infection. And of course, immunodeficient animals will harbor this type of infection. Not all Citrobacters there are other species of Citrobacter, and this appears to be the only one that is pathogenic for the mouse. Now, over the years, a number of other causes for this lesion have been identified, including Helicobacter and non-lactose fermenting E. coli. These atypical E. coli infections are usually seen in immunodeficient mice and may be complicated by concurrent Helicobacter infection. There are a number of Helicobacters which infect mice, but the one that usually causes typhloColitis in immunodeficient mice is Helicobacter hepaticus, with lesions most often seen in AJ, BALB-C, Swiss Webster, and ICR mice. Females have a higher incidence of enterocolitis, and males affected with the same strain often have a higher incidence of hepatitis. A spontaneous disease of mice that's very difficult to eradicate in labs as the eggs are very resistant is pinworms. Pinworms don't cause a lot of problems. You may spontaneously see them within intestinal biopsies. There are two main species of pinworms to be concerned with. One is Cephasia obvellata. The other one is Aspiculurus tetrapterus. The life cycle of both parasites is direct, and with those resistant eggs, you will occasionally go months and years without seeing any, and then all of a sudden they'll pop back up. There are some differences between the two. Aspiculurus ova are symmetrical, Cephasia are not. Cephasia deposits eggs around the anus, Aspiculurus does not. Both of them cause minimal or no disease in affected animals. you can see focal inflammation around areas of invasion in the mucosa in immunodeficient mice, and very rarely rectal prolapse may be attributed to heavy infections. It's most often seen in young mice, and a form of immunity appears to develop with age. Finally, rectal prolapse. We mentioned at the beginning of this lecture that the rectum of the mouse is not anchored by serosa. It tends to be sort of movable, so a lot of these particular diseases that we have talked about in terms of diarrhea can result non-specifically in rectal prolapse, including Citrobacter rodentium, E. coli, Helicobacter, enterotropic mouse hepatitis virus, and the rare cases of pinworms. Okay, well, that concludes this lecture. In our next lecture, we're going to have a fairly brief one and talk about liver diseases of mice. Hey, I hope you enjoyed this, and I hope you all have a great day.